Hello, my name is Dallas Carter, and I'm applying for the Doctorate of Nursing Practice program at Weber State University in the Family Nurse Practitioner lane. The Doctorate of Nursing Practice is a program that will prepare nursing students at a doctorate level to serve as nurse practitioners. As a family nurse practitioner, graduating from this program, I hope to be prepared to give patient-centered care that is evidence-based, as well as a family nurse practitioner, I'll be able to serve patients throughout the lifespan in an outpatient setting. I often explain or describe this to my friends that have not heard of what a nurse practitioner is or what the Doctorate of Nursing Practice does, is that a nurse practitioner in Utah is allowed to have their own practice, and they're allowed to diagnose and prescribe medications. And so you can sometimes think of it as like a doctor. They can serve as a primary care practitioner, but they have a different background. Instead of going to medical school, a nurse practitioner has gone to nursing school and has a background in nursing practice, as well as obviously has graduated from a nursing practice program, whether it be doctorate or master's level. As far as what motivated me to pursue this degree, I decided in high school that I wanted to be an endocrinologist. As a type 1 diabetic myself, I wanted to be able to help people in my own situation, people with diabetes. And I considered going to medical school to become an endocrinologist. As I studied my prerequisites at Weber State, I began to question whether or not it was for sure what I wanted to do. At the time, my backup plan was to be a PA. And I knew I would need hours in the medical field, so I went and got my CNA certification. At that point, I learned what a nurse practitioner was. I didn't have much knowledge of it up until then. And the idea of being able to give direct patient care as a nurse while I was studying to become a primary care provider really interested me, and that's kind of what turned me onto this. I knew then that this was a path that I wanted to pursue. Things that I bring to the table, I believe, as a nurse practitioner are my passion for learning as well as teaching, and my desire to empower people to live healthy lives. That's really kind of what I imagine to be my mission statement, is to empower my patients to live the most healthy lives they can, and I do have a passion for that, having experienced it myself as a patient and wanting to help others to live their best lives. So I've seen a lot of diabetics as a nurse and worked with them, and that is the population that most calls to me. How does the program enhance my professional career? I believe that being doctorally prepared as a provider will give me the confidence that I need to be a competent provider. And I believe that the doctoral level programs really elevate the profession that is a growing one in nurse practitioners and a very important one in the community. And I believe that as nurses continue to be doctorally prepared and enter the workforce, they will be able to give patient-centered care in practice, as well as make informed policy decisions going forward to improve nursing practice as a whole.